Good afternoon and welcome to today's webinar titled Simple Solutions for Complex Clinical Problems, Cloud Innovation You Need to See to Believe, presented by Healthcare Innovation. My name is Rajiv Blumenthal. I'm the Managing Editor of Healthcare Innovation. Today's program is sponsored by Extreme Networks. Thank you so much to our sponsor and to you, our audience, for giving us your time and attention today. Before we get started, we do have a few housekeeping details to go over. First, to submit a question, please use the Q&A box to the left of your video window at any time. You do not have to wait until the end of the program to submit a question. For technical issues, please press F5 to refresh. And if that doesn't work, you can submit a question with your issue through the aforementioned Q&A panel. Finally, we encourage you to join our conversation on Twitter today, and you can tweet by using the hashtag HILiveWebinar. With that, I'd like to introduce our expert speakers for today's program. We have with us Dr. Andrew Huff, who is the co-founder of Metrics, a company that develops predictive systems to solve complex problems. Dr. Huff was also previously a medical professor and hospital epidemiologist at both Columbia and Michigan State University. We also have with us Doug McDonald, who's the Director of Technology at Extreme Networks, and we have Matt McNeil, who's the Senior Sales Director, Enterprise East and U.S. Healthcare at Extreme Networks. And we will kick it off to start with Matt. Matt, the floor is yours.
Yeah, thanks, Rajiv. And thank you, Healthcare Innovations. Always appreciate the partnership and support. And also thank you for the attendees for taking time out. I know we've had a lot of webinars over this pandemic and more Zoom time than some of us maybe want, but do appreciate the time to take a few minutes here with us this afternoon. So again, my name is Matt McNeil. I'm the U.S. Healthcare Sales Director here at Extreme. It's a job that I've had a privilege to take over the last three and a half years since joining Extreme. I am one of almost 3,000 employees that hit over 80 countries. We're headquartered in San Jose, California, and we're a little over $1 billion of revenue for those who are not familiar with Extreme. Quick note on that revenue piece. Healthcare is a big piece of that for us here at Extreme. Revenues tend to be 10 to 12%, so over $100 million of capital do flow through healthcare solutions and needs over our 20 years of innovation, and that goes into it. But just want to give you a quick notes on our background. Mr. McDonald, who is joining me from Extreme in the office of the CTO, does have a heavy healthcare experience as former director at Henry Ford for their network and mobility infrastructure. Doug, anything you'd like to comment on why Extreme for healthcare?
Yeah, absolutely. And thanks, Matt, for the introduction there. So we'll dive back in here to why Extreme for healthcare. So as Matt mentioned in the introduction, I'm the Director of Technology from the Office of the CTO. I worked for a very long time in healthcare where I was responsible for strategy, innovation, and infrastructure, or I would call, managing most of the blinking lights. And there I was very successful using Extreme as an enterprise standard. So one of the key reasons I joined Extreme was the ability to deliver flexible, agile, and secure solutions that simplify the complexity of today's connected hospitals, which really complexity and hospitals don't go together, but really looking, to cover that gap and to reduce some of the complexity and really focus on patient care. The less that our clinicians and folks are fumbling around with technology and more focused we are on the patient experience, the better off that we're all going to be and have a better, more streamlined, more caring type of healthcare opportunity with our patients. So focus more on patients, less on technology, and making it easy. So from there, we look at really supporting end-to-end network technologies that help to achieve this kind of operational efficiencies and profitability. And I'll touch on some more of these topics as we go through the presentation. I'll save some of the thunder for some of the later slides. So we are extremely focused here at Extreme Networks on our healthcare customers. We are continuing to grow. I was just looking at where all these dots are lying and know that there's some updates that are going in. I'm constantly talking to a number of customers across the globe, understanding their challenges and making sure that we're meeting or exceeding what our customers require from a healthcare perspective. So over that 3,000 number, and we're very proud of that. So diving right in, so just some quick accolades. This is one of my favorite as a former customer. We've received the Gartner Peer Insights Award from Customer Choice specifically last year, and we had some consecutive wins in a lot of these categories I'm going to touch on very briefly. What I like so much about the Gartner Peer Insights is this is an award that's given by Gartner going to our actual customers, to understanding their experience and having the customers rate us specifically. So this is a testament to the job that we do every day, and a lot of these things are really great. Our 100% in-house support, all sorts of great things, our CSAT score, which we're very proud of, and one of the things I think is most unbelievable is we have an average tenure of 14 years for our folks that are supporting you. So when the event comes along where you do have some issues, you're getting people that are seasoned, and that's really great. As a former customer, I'm really proud of that metric. So we switch into some more things from Gartner. We're happy to discuss. We have a three-peat. We once again are in the leaders quadrant and have been rated #1 in service in both wired and wireless access infrastructure and data networking. So we're really proud of this. We continue to strive and work really hard to continue to stay in that top right, and we're very fortunate to be there once again. And it's a testament to all the hard work that we're doing here. One more accolade, we were as a cloud provider named CRN's 2020 Network Product of the Year. So this is based off a number of different things, but our cloud is growing. We're the #2 largest cloud networking companies in the world, and we continue to grow, and we're really proud of this one as well. And nice to see that we're getting some recognition for all the hard work that we do every day. So what does that mean for us diving more into enabling the future of healthcare? So I discussed this a little bit in the earlier slide, but what's key to take away from here is this is where we're really focused on. When I'm talking to healthcare organizations, just like the large one that I came from, we were really focused on hitting these 4 categories. Improving the patient experience, I think, is one of the highest ones other than cost. And, you know, with HCAP scores and the different technology needs and demands, we joke all the time, or I do, about, you know, the food was cold, but you saved my life, but I marked you down in the HCAP scores because I really didn't like that cold food. And that can impact funding and have all sorts of interesting consequences. I talked to the same about guest Wi-Fi. I couldn't FaceTime with grandma. Having a remote connection with our families in the hospital is even more necessary than ever because of this fun virus that Dr. Huff will talk some more about later. But it's really important to have that experience and capability. And where I came from, we had all sorts of great patient experience stories. We used to provide birthing for our servicemen and women from overseas. All sorts of great things there from that perspective, patient portals, location capabilities, all those things that our patients have come to expect from this ever-connected world. Of course, we're looking to reduce costs. By improved population health, really what we're looking for is with our agility and with our flexible networks, we're able to connect people from everywhere. So whether that's in a cornfield or whether it's in a big city, how can we help get healthcare closer to our patients? And how can we have this streamlined network experience and all the fun data stuff that we're going to talk about later? How can we get there? And overall, the improved clinical experience. So the less the nurses are fumbling with technology, the better off overall we're all going to be. So if we move into our data architecture, one thing I want to emphasize here is we have a number of very flexible opportunities as purveyors of wireless and wired technologies. We do have that on-premise flavor as well as private cloud and public cloud. So if you're still looking at adopting the cloud and moving that way, we do have those flexible capabilities. and really focused in on the containers at the top there, and insights and analytics, our automation, our management and orchestration, our ecosystems, which brings in our metrics partnership that we value so much, and of course, top of mind, especially since the pandemic, as bad actors have increased, kind of while we're all down and busy looking the other way, security and access control, and how we bring all these things together to support our most remote clinics in the edge, our overall campus connectivities, and our data center, and how we wrap all those together, really put a bow on top to make them easy and flexible from a networking perspective. So flipping to the next slide, we have a tremendous story right now of explosive growth in data and healthcare. Some of these numbers are really mind-boggling when you take a look at them. We've got 75 billion devices by 2025, which we're talking about 10 times the number of people for connected devices. So in the world of IoT and data, it's so important to have that agile network more than ever. We're seeing 463 exabytes of data that are generated daily, and 5.1 billion mobile users. But with all these increases in all this technology, all these connected devices, these machine-to-machine connections, less than half of our IT teams are going to get more headcount. So from Extreme Networks, we really focus on emphasizing this, and we've got to be focused on how do we make it simpler to manage these complex networks, and we certainly do that. Some of these other interesting statistics on here, 100 million number of IoT attacks in 19. The numbers are still coming in for 20. I was crunching those, but really crazy amount of attacks that we have to safeguard. And as a result, we're seeing a great amount of technology investment specifically in security. So you see that 40% state that security is their number one investment, and we like to wrap our security into our network interfaces and continue to grow those capabilities. So a lot of different devices are growing our data footprint, and that brings us to our next slide, which I think is one of the most near and dear topics to my heart, and is how can we utilize cloud and our data and all these exabytes of data and utilize machine learning and artificial intelligence to start to make our networks truly intuitive and simplified. So not having just this architecture and these marketing words of, hey, we've got AI and ML, but actually putting this into practice. So if we look at our cloud and its current offerings, we have some pretty unbelievable numbers. So we averaged out our customer network devices, and they're sending an average of 5 petabytes of data daily. So this is an aggregate of all your devices that are talking on your network. So if we put that in perspective, 1 petabyte of data is about equal to about 13 years of high-definition video. So if you take that and aggregate what our cloud XIQ service is crunching, we're looking at about 40 years of HD video is being processed on a daily basis, which is a pretty crazy stat to me. 4.2 billion management events. But how do we bubble all this data down and make it actionable? We talk about that organized data really is information. So we're taking these events and we're starting to do some interesting things, and we have the information there. We need to build on that. We go into learning from the information. So I say knowledge is taking that organized data and learning from that data. And then the next key piece we need to do there is take that knowledge and apply that knowledge, which gives us intelligence. So I think that is a really good segue into a very exciting partnership with a very innovative company. Dr. Andrew Huff is joining us and co-founder of Metrics. He has a very interesting solution that we partnered with to, number one, help people, right? So we're all trying to get back to work. We're trying to prevent COVID. Every day there's another headline, and we're really excited about this opportunity. And Dr. Huff is all about taking his IoT device and giving us knowledge and intelligence to help get us through this pandemic. So Dr. Huff, take it away.
Thank you. That was a very kind introduction, Doug. So I think it's a good place to start would be to discuss the current state of COVID-19. There's a lot of interesting things going on globally. I think a good place to start would be discussing these two figures here at the bottom. On the left of the screen, you'll see the epidemiologic curve of cases in the United States. So we really had things ramp up through the fall of last year. Things have coming back down, and they've sort of leveled off, and actually they're ticking back up. This figure is based on data, which is about 7 days old. There's a lot of variants emerging now in the United States, and I think I can discuss why that's important here by looking at the figure on the right. So this is the 14-day case notification rate per 100,000 inhabitants in Europe, and this is European CDC data. I know that there's some people from Europe joining this call, and things have really taken off there. And part of what's driving this is that they have these more contagious, more transmissible variants in the population, and they relaxed a lot of their policies. Now, we could get into a big political debate whether things should be locked down and whether people should be mingling, but we can't remain locked up forever. And if you look at historically throughout pandemics in human history, they typically last somewhere between 2 to 4 years, and that's the last 4,000 years of human history. So, what's really going to drive the reemergence or the next wave of cases in the United States and globally is that there's really a severe global vaccine supply shortage, and that's on the production side. I'm sure many of you have heard that the AstraZeneca vaccine is going under heightened scrutiny right now, and there might have been some false data reporting that occurred early on, and that's actually being investigated here in the United States. To go along with that, even if we're able to produce enough vaccines, and we're talking about 8 billion vaccines, I mean, that's such an incredible number to get everyone vaccinated. That takes time, and there's a lot of supply chain problems associated with that. And I'm not sure how many of you have experienced other supply chain shortages in other products or other things that you've been using, but they're also affecting the vaccine supply chain. So these, unfortunately, these problems are likely to continue throughout this year. And that's coupled with this fact about variants. So, a lot of people are wondering whether or not, vaccines are going to hold, what effect the variants will have. Well, unfortunately, most strains of COVID, these mutant strains that are coming out, are all independently developing the same mutant characteristics to evade vaccine, which evade the protection of the vaccine. And what that means is the vaccine will likely be less effective over time. There's a lot of talk about creating boosters and other shots that will address these variants, but that unfortunately takes time. And then to be able to scale up production of the vaccine for variants is very challenging to be able to simultaneously do that with the existing vaccine. You basically have to double the size of your production and double the size of your supply chain, which can't happen very easily. Now, how does this relate to AI in healthcare? So I'm going to take a quick turn here. So typically, AI has had a really tenuous relationship in healthcare over the past few years, at least on the clinical side. So historically, AI makes bad decisions worse. So one classic example is that IBM Watson was used, and they were going to analyze all the clinical healthcare data to try making predictions about clinical healthcare. But really here, that created a situation called garbage in and garbage out. And why that is such a problem is that, sometimes more data is not better. It's really difficult to predict things. And really the clinicians have this fear of AI in the black box. And when you really drill into it, the most frequent causes of failed AI in healthcare is that there's high variation in the data. There's varying patient workflow data and treatment processes, and there's inconsistent or non-reliable data and collection processes between practitioners and clinics, and many clinics have unreliable or slow networks. So many clinicians do not see the value in the technologies for these reasons. So that led me to believe, or led us to work on this technology we've been working on here at Metrics. hello, can you get, well, I think my own network's having problems. Can anyone hear me?
Dr. Huff, we can hear you right now. You want to try again?
Yeah, I think I'm having some problems here, but I think my network caught up. So my apologies. It's been a little bit difficult afternoon. So where I was going is that our AI-driven solution that we developed here at Metrics is called the K1. So this is a product that we developed that analyzes the temperature, the heart rate, and the respiration of the person. And we use artificial intelligence and machine learning to analyze that respiration pathway. And why that's important is that we're able to have an automated COVID screening process, which is faster, more accurate than existing technologies. We can integrate this information with electronic health records, electronic medical records, and it enables infectious disease surveillance in real time. So you might be asking yourself where you can get funding for this, and there's two different funding sources available. One is from the Department of Homeland Security, and there's currently $1.87 billion available. And in order to get that funding, you have to partner with with your state or territory officials. There's also $179 billion available from the CARES Act, and that's from the Provider Relief Fund, which I'm sure many of you are familiar with, and that's been extended to 2021. In the European Union, there's two different funding sources. I'm not as familiar with these funding sources as I've never applied to them myself, but there's two up. There's the Strategic Alliances for Uptake of the Advanced Technologies by SMEs, and there's a second call for expression of interest for innovative rapid health-related approaches to respond to COVID. And I've provided the links here, and you can go access that information yourself. I've tried to go through the application myself, and it's actually not too complex. So you might ask yourself, what led to the digital transformation of your company? And in this year and the years past, it's most of the people that we survey and we talk to, they say it's COVID-19.
Yeah, thank you, Dr. Huff. A really great presentation. And just to circle to Metrics has integrations into our cloud. So as we continue to grow our capabilities with IoT and all these great companies like Metrics, what's really important, what our desire is to move to have non-networking devices in our cloud that provide business insights to make better and real-time decisions. So Dr. Huff and his solution from Metrics is one of these amazing technologies that we're closely aligning with our technology and to try to help folks through this time, like I said before. So thank you, Dr. Huff. We're really excited about your technology and the good that it's doing in this turmoil time. So Matt, I think you're going to wrap us up. Can we go into questions?
Yeah, and we'll pass over to Cass. Thank you, Doug, and again, thank you, Dr. Huff, for joining. We're excited about the Metrics solution and the integration to RIQ. Obviously, data is relevant and important, and we're going to continue to drive that for our clinicians, long-term care, and acute care facilities across the board. Also, a quick note, Dr. Huff and this company does play across, multiple verticals. So obviously we're here for healthcare, but obviously transportation, retail and entertainment, office buildings, financial services, and all the needs that come into it. But I really appreciate everybody's time here today. And I do see we have a few questions. Rajiv, do you want me to handle or would you like to take those, Rajiv?
Absolutely, you can handle it. I just wanted to quickly remind before we kick it back to you, just wanted to quickly remind the audience that we have some time, so if you want to submit a question, you can use the Q&A box to the left of your video window at any time. So I'll let you handle the questions, Matt, and then we could wrap up after that.
All right, thanks, Rajiv. Appreciate it. So Dr. Huff, you're up first. Actually, there's a couple of questions in here for you. So how does the accuracy of the K1 compare to other methods that are currently being used?
Yeah, that's a great question. So let me take a step back and talk about the underlying technology and how it works. So in the K1, there's something called a time-of-flight sensor, a millimeter wave sensor, and then also one of the top-of-the-line FLIR thermal sensors. So we're actually able to take 450,000 measurements per second with the K1. So that makes it highly accurate. We can't say that it's medical grade, but we're definitely trying to get into that space to actually have FDA approval as a medical device. So it's highly specific, it's highly accurate. If we were going to compare it to, a FLIR handheld thermal camera or device, or a person actually using a stethoscope to listen to a person's heart rate, it's actually more accurate than those devices.
Awesome. It looks like Dr. Huff, you're still up. There's a couple more in here for you if you're all right with it.
Yes, sir.
Another question here. Yeah, so can you elaborate on the process again in which some would apply for the government funding you mentioned?
Yes. So no, I'm not as familiar with the European Commission funding. I've actually only worked on a couple projects over my career with the European Commission. I think it's fairly straightforward, and I think it's very similar to the U.S. grant process. So you go in, you enter all your company's information, your organization's information. Usually they ask for some kind of financial record or business transaction record, and you supply that, and then it goes in for approval. In the United States, in the two funding options that we have available, if you go to the links and you go to the website and the information we provided. So through the Homeland Security, the DHS Homeland Security grants, to apply for those, you'd have to partner with a state or territory official. So that means you'd have to contact someone from usually like the State Department of Health or the State Department of Homeland Security, and you would submit a joint application for the technology, and then you could receive reimbursement through the Department of Homeland Security for our technology. On the flip side, if you look now at the CARES Act, that's very straightforward. I actually went through it last night to see what it's like to apply. You basically go in, you state the need of the product, you attest that there's a COVID-related need, and then the Department of Treasury or Health and Human Services sends you a check within 30 days.
Yeah, I like the check within 30 days.
Yeah, I was really amazed at how simple it was.
I saw that too, Dr. Huff, and I was, it is more aggressive, which is good.
Well, there's no authentication that really takes place, or validation. They might be doing that after the fact, but the mere fact that the only thing you have to do is that you attest that the information is accurate, and then they reimburse you. I was quite surprised.
Okay. Yeah, thank you. And then while you're still up, I'll keep coming, all right? So, Dr. Huff, can you explain the difference between the two modes in which the Metrics K1 operates? Will the K1 capture the same information in both cases?
Yes, so the K1 comes out of the box, and when it's configured, there's two different modes. So there's one that's called the anonymous mode, and the other one's called the recognition mode. So it really depends on the customer's use case. So here in the healthcare setting, you might want to use the anonymous mode at your front door. So that means you have patients and people entering the front building. We're not going to capture any personal identifiable information there. There's no identity that links to the product in the back end. In recognition mode, we're able to either scan a QR code, we're able to use facial recognition on the person. We also have a HID scanner on the front, which can use RFID, Bluetooth, or NFC to identify the person. So then we are linking those scan results to identity. So depending on the use case and where the device or where you want to use the device, it can be configured for two different distinct use cases.
Yeah, that's good to know. All right. You're off the hook for a minute, Dr. Huff, all right?
So all right, thank you.
Yeah, no worries. Doug, I'm gonna put you on cue here. All right, we got another question. What are the IoT sensors and use cases being leveraged into Extreme IQ Cloud? And how are you improving the patient experience? So I'll give you a second to think about it and read it again. What are the IoT sensors and use cases being leveraged into the Extreme IQ Cloud? How are you improving the patient experience?
Yeah, and improving the patient experience is certainly one of my direct missions, especially having been in that operational and strategic role so long in healthcare. So topic near and dear to my heart. So I'm actually out of the CTO office running a program with multi-cloud capabilities for third-party integration. And in there, we're working with about 100 different partners to bring, more business-related and/or patient information data capabilities to improve what we produce. So in our dashboard or our single pane of glass, you don't just see the networking statistics and some data. You're starting to see business integrated data like metrics. You're starting to see things like temperature sensors. So capabilities and partnerships where the patient may be able to adjust the temperature in their own room. When I go to my parents, I have to bring a pair of shorts and a t-shirt because their house is so hot that I can't stand to be hanging out there, right? So there's many different needs for our patients that can be done with environmental systems and several things like that. The other big move that we're seeing is keeping track of real-time location technology, so sensors and BLE devices, tracking where patients may be, tracking where your care team may be, and streamlining some capabilities from that perspective. So there's a number of these exciting things that are going on at Extreme. I think the last one I'd mention is touch with remote patient monitoring solutions. So bringing in data into your corporate hospital infrastructure that allows you to bring in some things like vital signs and some basic things, post-surgical capabilities. Maybe you have a BLE-enabled scale. Maybe you have some of these other kind of smart home remote patient monitoring technologies. And we're looking at a number of those and working with them to bring that data in, provide it effectively and securely to our clinicians. So that's just a couple to mention there.
Yeah, thank you, Doug. And I just on a conversation this morning about asset tracking and clean closet, dirty closet, as far as kind of the capabilities, housekeeping usage, and all the things that can go into making patient satisfaction improve. But across the board, from our Wi-Fi to our switching to our guest technology, we definitely leverage that information to our clients to take advantage of some of the data informatics at a metadata level as well into the cloud to see some trending information and how to affect the patient experience in a positive manner. So great question. So thank you, Doug. All right, let me see here. So we do have a few more minutes. So any last questions, comments? Feel free to post them into the Q&A window. Thank you for those questions for Dr. Huff and Mr. McDonald. We'll give it just a second, Rajiv, and I don't see any yet coming in, but do want to summarize here. Again, thank you, everybody, for attending. It's great to have a partnership with Metric. As you can see, doing things above and beyond, integrating into our cloud solution as we continue to grow the partnerships across the globe. Obviously, we do appreciate your time and patience here this afternoon, this morning, and across the globe and this evening. Rajiv, I will pass it over to you. Thank you for your time again.
All right. Thank you to our, it looks like we did get one more question. Do you want to take that one?
Yeah, let's see here. All right.
Right at the
I'll take it. Dr. Huff, again, can you elaborate, or Doug, both of you all, can you elaborate on the integration with EHR and automation?
Sure, I guess I can take a quick stab at it. So with the Metrics K1, we can integrate with the patient healthcare record. So because we're capturing such high fidelity data around respiration, temperature, and the heart rate or heart rhythm, that is valuable information for the clinician. So essentially what the K1 has done is we've actually automated the first step of healthcare. So when you go into the doctor, oftentimes the nurse will take these measurements from you. We now have a way to get a very crisp, precise data record now easily into the patient record if the customer so desires that.
Yeah, that's a good point, because I just went for a checkup not too long ago, and it has a little cube outside, I'll call it. It's a little container, and they took my temperature outside, Dr. Huff, and they asked me to remember that when I went inside and actually did the exam. So I actually individually repeated it, and hopefully my memory was correct, right? So eliminate some of those errors and all the different things as well that goes into the conversation pieces. All right. All right, I don't think I see any other questions, Rajiv. Rajiv, I will pass it over to you. Thank you again, everybody.
All right, and thanks to, once again, thanks to Dr. Huff, Matt, and Doug for a really informative presentation. We really learned a lot. It was an excellent webinar. Of course, we'd like to thank our sponsor, Extreme Networks, as well, for making today's program possible. Finally, I want to thank our audience I want to thank everyone in our audience for joining us, and we really hope you'll join us in the future for another healthcare innovation webinar. With that, this concludes today's presentation.
Thank you, everyone.